in a day or two.
Yeah,
That's even better. That would sell that would be a selling point on the vaccine.
It makes you younger.
Cheryl, get inside. You're going to freeze to death.
Yeah. I'm just trying to embrace this new weather.
You can see that Todd is already getting prepared for St. Patrick's Day.
Yep.
Yeah.
Yeah, we're moving right along.
Todd, I restrained myself. I didn't put up the Tampa Bay logo behind me.
I was wondering if I was going to see something.
Oh, I have it, but I thought, nah, that's okay.
That's all right.
Yep.
Yeah, we're moving right along. We're moving right. Just didn't have that desire.
Todd, I restrained myself. I didn't put up the Tampa Bay logo. Oh, wow. Feedback. It's lovely.
Volume's working. Sorry, just
That'll get us to shut up.
we are live. We are successfully on YouTube live.
All right.
Excellent. Okay, who are we waiting?
I don't think we have a quorum.
I'm here. Can you hear me?
Yep, we can hear you, Angie.
All right.
We have a quorum, but we're still need to wait for Dr. Halverson so he can chair finance.
Okay. Maybe we can start and John can join us in time for finance because we do have a presentation. If that's okay with everyone.
Sounds
Stay with
good.
me.
Excellent, excellent. So we need introduction of guests. Do we have guests?
No guests today.
Excellent. We need approval of the agenda for February 16th, 2021.
So move.
Second,
Second.
all in favor?
All right.
Okay.
Excellent. Approval of the minutes from January 9th, 2021.
Move approval.
Second,
Second.
excellent. Presentation, COVID-19 local perspective update.
Do we need to vote?
I thought we voted. I'm sorry.
Did we?
All in favor?
Aye.
Opposed? Excellent. Okay, now we can have our presentation.
Well, I'm going to start. Are you going to put it up on the screen or this? I'm covering for Peter tonight. It was a little bit about kind of the local perspective, our monthly update. Hard to believe we have another month that has really kind of passed along on this. But I think it's starting to, as you can see, as we're getting a little bit more data, one of the interesting additions to the slide deck that he wanted me to point out was on the slide deck right from the CDC that talks a little bit about some different visualizations and trending overview of Winnebago County. I know it's kind of hard to see it in your presentation, but if you go to the website, you can actually then take a look at cases, deaths, percent positivity, where you see it bouncing around our first wave of the pandemic and the second wave. Our testing volume, I think a lot of times when people talk about the positivity, it's important to look at the testing volumes, right? When we look at percent positivity, it's not just number of positive, but how many tests overall. And of course, we're starting to see a little bit of that variability again, because testing is down overall. And of course, with the colder weather, people are not going, the last couple of days have not been big in terms of testing. I think the other part is to take a look at some of the measures regarding ICU beds, which became kind of the whole trend. I'm not sure if this is, but again, it's, you know, as obviously the data gurus get more adept at this, they really are producing a lot more data at the local level and really allows us some comparison against others. You also, the next slide kind of really reinforces that are not. Obviously, as we've moved through some of that, you can start seeing us trend downward. You can see where we, you know, had some peaks and valleys. Obviously, we want it below 1, and we're currently running at 0.82. And at that point, at the time that this was run at the end of January, our positivity rate was at 5.3%. We're now dropping it closer to 3%, which is more like we were over the summer months. And I think the last press briefing I gave, it was the last time we were at this low was at the end of August. So it tells you how long it took for us to get there. And obviously now they've got a percentage of percent vaccinated has been added on that. I can go through, and if you've had some time to take a look at some of these, I think the other part, we've kind of kept the report as much as we can so people can look at it on a regular basis and kind of see that. I think the other thing is the COVID-19 positivity rates and mitigation. You know, we often get asked which mitigation strategy. That's slide, it's on page 13. I don't know who's directing the slide, so I apologize. Up, go back. I apologize. Go back to COVID-19 positivity rates and mitigations. There we go. This is kind of a busy slide, but I think the important thing is to take a look at when people ask, what are the impacts of different mitigations that occurred? So this is the timeline against the trend on the 7-day positivity rate rolling average, so that you can really start to see why, you know, when we got into mitigation levels, number 3, and then when you start getting into number 4, where we start moving into, we start looking at where do we go from here and how long did it take after the mitigations were applied. And so you start to see why those 2-week plus incubation periods are extremely important. And of course, there's a concern regarding Super Bowl weekend. So we started out, I know Ron was giving Todd a little grief about Green Bay Packer and Tampa Bay, but there is concern that we might see a little bit of uptick in cases. And you might have heard the deputy director or the director now saying, recommending that people get tested now that it's been 2 weeks since, you know, we would expect to start to see positivity rates related to infection or around that time frame. And of course, we're continuing to watch the variants, right? Because while vaccinations have proved, you know, very promising and effective, and we're about, you know, % of our population getting vaccinated, we still have the concerns about the variants that are out there. And there's a whole lot of discussion about, is this country even testing enough on surveillance on all the genotyping that's required? And they were looking particularly at the California, that looks like we have one of our own now, besides the UK, the South African, and that we have one now called the Southern Californian. So taking a look at where those are at. And we announced 2 weeks ago, really our first variant in this region was in Lee County. So again, you know, once you start seeing it, you know it's someone that would not have traveled internationally or to another region that you would have expected to have the variant. Not uncommon as viruses, as we, the natural evolution of viruses, and we're hearing and learning more about that. It depends upon where the mutation occurs, about whether or not there's concern about whether it will be more virulent, spread more easily, and whether or not the vaccines will be effective against it. So we're continuing to watch at those levels. The mix of cases by age has been relatively consistent. So we're not seeing any changes in as more children return to in-person learning, you might expect that again. And again, our cases and death by age cohort continue to be about the same. What's I think really now kind of becoming cases by race and age and ethnicity is that it's our Latino population that's been impacted disproportionately. I mean, initially it was our American, it is now kind of now leveling out that our Hispanic Latino is disproportionately impacted at younger ages. And again, kind of that discussion about whether who's in that essential or that frontline workforce. So kind of, as we continue to take a look at that. The other thing is looking at our age adjusted case rate, which is the next slide, one more down. There we go. So when you start looking at what the expected versus where they are at, again, these become very concerning about why we continue to take a look at, are we vaccinating with the equity lens in place on this? Because these were, again, based on race and ethnicity by age, their age-adjusted morbidity rate was higher in the Black and African American communities and the Hispanic Latino communities. So we've got some work that we need to continue to do then at that point. I think the next most interesting slide, the rest, again, distribution of ages and hasn't changed. It's interesting though, when we start talking about gender, females continue to be disproportionately impacted. We know there's no genetic predisposition among female gender. However, males over the age of 60 are disproportionately impacted. So when you start looking at some of the things regarding the rollout of phase 1B and vaccination, how large do we call it the rolling criteria on phase 1B, is really trying to get those impacts. Is that, again, concern about if you don't lower it fast enough, are you going to get to the vaccinations? Now, of course, a lot of things has to do with supply. Let's not, kind of minimize that. But why is Illinois expanding criteria in phase 1B? It's really because of that data that we have. And I apologize. I know it's one more down. Yeah, there's the one about males. And then again, that has been consistent over time. I think admissions and ICU use as the next one kind of coming down, because again, when we first started kind of looking at this, we talked about ventilators, we talked about capacity, but you can really see the difference where our first kind of wave of the pandemic, the first surge occurred back in the early months, almost a year ago. And then that second impact that we had, where we had high ICU admissions in the fall from October, November, December. So significantly more. And again, you start to see our ICU availability has continued to improve over time. And probably the last slide that I'll take you to, because I know there's a lot on here, and obviously the specific question is that comorbidity slide, which is the last one with I call it the balls at the very end. So again, when you started seeing the expansion on the phase 1B to individuals with chronic conditions, you start to see what they've pulled in there. And this is because, again, we've looked at the same top 10 as the prior month, and there's been no change in rank order: hypertension, diabetes, asthma, former smoker, obesity. And I think for those of you, I shared a little bit of our Qualtrics data. Obesity is the #1 reported comorbidity amongst ours. But again, this is pulled from the actual case, those who have had cases versus those that are registering for the vaccine. And then you see smoking, both current and former smoking. So I think, 7's a little concerning to me. I'm not sure what we've got in the unknown category, but that's obviously coded. But as we take a look at those, when people ask me, why don't you ask about every medical condition on the Qualtrics? It really is related to those criteria and those comorbid conditions that are most associated with morbidity and mortality from COVID-19. And you can see that there's a layering effect. And so some of our hospital systems, when they first started vaccinating and they had their over 65, probably the most developed one kind of was to take a look at OSF St. Francis Peoria group. That whole group had come up with a formula where they ranked order the comorbid conditions against age. And that's how they pulled their patients through and notified them to come in and get vaccinated. So, I often hear about why was this person contacted ahead of me, or, how did they get through? And it really was looking at that age and then the comorbid weighting that they were putting on that as they pulled their patients that were enrolled in their systems through for vaccination. I think that probably what you don't see now, which was just put up at the end of last week, is now there's a vaccination dashboard. And maybe, I don't know, is Christina or Katie driving? I was going to say.
I'm driving it. I can go to it.
Yeah, you might be able to pull that up to show people a little bit where they can go on a regular basis to know about vaccinations.
Mhm.
So this is the main page for coronavirus disease for the Illinois Department of Public Health website. If you go to vaccine information, vaccine.
You can go vaccines administered right here, Katie.
Okay.
If you click on that.
Here.
You click on the green bar. It will always be green. So that's a good thing. We're getting so many colors now at the state. And this will take you right to their vaccine, the information. So if you want to scroll to the top, Katie, you can take a look. You can actually take a look at how many doses are in, what's being administered, how many are in long-term care. And then you can click on Winnebago. If you go down to select county, good news is we're kind of always toward the bottom, so it's easy to kind of scroll through. And it will then take you through the Winnebago County data. So you can get the daily reported vaccines administered, the number in the population who have been fully vaccinated, the percent, and then the population estimate that they're looking at. And there's a little bit more details that come through. Some of that is, and this is fed through the eye care system, where you start to see, I think the age demographics is an important one, because I often get the challenge and the debate between the frontline worker and the over 65. And so we're running pretty close, in the kind of the essential worker, versus the over 65 and older. This is where you can also see where we have the racial ethnic disparity next to it, which is the race ethnicity demographic and the concern, because I talked to you about those comorbid conditions. And I think we've all known that. We've talked about our communities of concern. And again, the challenge that we have in addressing that inequities and that really the health disparities associated with the disproportionate impact. So kind of take a look at that, and you can scroll on down. And this one's kind of every county. So it's, this one they haven't really, but then if you can, I would say go down to the next one, Katie. This one really doesn't tell you a whole lot, but if you go to the very bottom of this one, you have to scroll all the way down again. So I often get, this is where our reported inventory gets reported out. How many community-based sites have inventory? We've asked for that, well, who that is, right? And nobody, and then what's our total? So they add the two to get to your total. So right now, this was as of, I forget which date, if we scroll back up, but, we had less than 120 doses reported in stock. So, and that was today, that was as of this morning. And so we do have, again, planned vaccination events as we move out. And then, you can take a look at your person's fully vaccinated and then the percent that are fully vaccinated. So the state puts that up just like they did for the cases. And so we are referring the population that's on vaccines administered. That's a little bit different than our Qualtrics on the other side that I kind of showed you how many people are registered, how many people are waiting through. But I think that when you start looking at, you can see where I'm going to say where the health departments are at in terms of vaccine that they have in stock versus community-based sites. But I think, again, we're learning more and more about. I think the other thing you might want to take a look at if you have time is that COVID-19 Community Vulnerability Index score by county. And they tell you how they calculate that, but you can take a look in terms of it. Unfortunately, it cuts off at the header, but it talks about socioeconomic status. It talks about, you go at the top, Katie, and I apologize because I know you're driving and I'm the backseat driver. There's a community vulnerability score. There's a socioeconomic status, the household composition, disability, housing type, transportation, epidemiologic, and healthcare system factors that get weighted in to get to your vulnerability index scores. And then if you click on the top, it actually tells you how they calculate that. Now, having said that, I hope it goes back to where they think they're going. So, these are a lot of these, I'm going to say these university-driven systems that are taking data from large databases and sources to come up with some of its scoring. But I think, again, it's certainly from where we were at, almost a year ago and how we reported out versus now what we have available to us in terms of tools. So when we talk about our vaccination rates and we've updated, you now know that we've gone from the circle to the triangle, which is our daily report to kind of indicate cases. And then, of course, we're building on the base of vaccination. So kind of a way to draw the public's attention to what we're doing now. And we've been in blue because we're in phase 4 of Restore Illinois. And we will not get out of phase 4. Well, theoretically, we're not coming out of phase 4 until we have a significant portion of the population vaccinated, which I think really is going to be, as we know, it's a challenge. It's going to take us a while to get there. But I thought you'd be interested in seeing that. And if you have any questions, you certainly don't hesitate to ask. I know we have both the annual report and the strategic plan report coming up. So just thought I'd bring that up. So thanks to Peter for putting that together and the data team with Abby. They've been doing a lot of heavy lift on this work.
Thank you for that. Speaking of our 2019 Winnebago County Health Department annual report.
Sure. Just going to share my screen here. And we did a brief overview last time we were together of the full annual report. I thought we'd just go through, present this out into the to the Board of Health with going through the domains, the different domain sections, and then just kind of showing you again what the data looks like so that you can explore that further if you want to as well, or if anybody wants to that's listening. And so it starts basically with our letter from the Public Health Administrator, and it really gives us a good overview of understanding just how much Public Health 3.0 led us to using the spirit of Public Health 3.0 led us to collaborations and coordinations with our different partners to work on the opioid response and becoming a trauma-informed community, and working also to work towards our community health collaborative partnerships that are allowing us to prepare for our assessment that we're doing this year. It really also was a telling year in that we were really busy even before COVID-19. In 2019, we did have incident command that was set up for a flood, and we did have incident command that we used in response to increase in gonorrhea cases. And overall, we were working on many things with the Board of Health and on our quality improvements as well. So we had a lot going on in 2019, and this report kind of just shows you what was happening in that year and what a more normal year looks like for the Winnebago County Health Department. It was a very busy year in 2019 as well. So our first domain as we look at public health we focused on the domains of public health and how we incorporate all of our Board of Health report outs into those domains. We continued that this year with our 2019 report. And so the first domain is monitor and health. And so we continue to monitor health, to monitor for increases in any kind of communicable or environmental health disease, which would allow us to determine if there's a problem and then investigate and identify to contain a problem. What we know that we kind of focused on working towards our sometimes longer term surveillance that we do is for things like West Nile virus. We also focused on radon last year with a contest that we had to try to encourage people to test their house for radon, and that we could use for further education. To the winner of that contest allowed us to take pictures in their home that we can then continue to use to kind of describe to people of radon issues. And radon, again, is a leading cause of lung cancer. We continued also to alert our healthcare partners to any disease surveillance that required additional monitoring. So that's where when there was a confirmed case of C. aureus in Illinois, we alerted them to that. That's an emergent fungus that could be hard to treat. So we had the healthcare community on alert for that. And we also worked with the data that they found from immunizations. Our health protection unit worked on increasing vaccination rates among those schools that had a less than 95% total vaccination rate in their area schools. So it's 21 schools that we worked to increase vaccination rates in. For our domain for diagnose and investigate, that's really that idea of contact tracing, identifying and mitigating the sources of illness and spread. A good example of that from 2019 was a cluster of E. coli, sugar toxin producing E. coli, in which contact tracing through the cases was able to identify a potential source at a restaurant. And so we were able to work with that restaurant to help prevent any further cases. And when you're trying to contain the spread, there's always an idea of source and barriers to treatment. So that our gonorrhea cases kind of represented the idea that you could make sure that you have access to treatment and care for those that you reduce that barrier to treatment for those cases. And then for the expedited partner therapy, really it was aimed at making sure that those partners can get treatment and care, and that the cases don't get re-exposed to prevent and reduce the infection. We also had reported vaping issues that year, and so we were able to monitor with the healthcare partners for cases of vaping, and when they got called in, they were able to do some investigation with a case and report the information up to IDPH to be used in investigation. So for Inform and Educate, we continue to use both digital, print media, and educational trainings to inform the community. We added to our digital media platforms Nextdoor that year, which we used a lot in getting the community health assessment information out to the community. We also use digital media on all sorts of different campaigns, including flu vaccination, radon, and West Nile. For our print media, and for our social media, in that case, in preparation for any kind of potential emergency, we did notice that when we put out a message on the cold, that the timing and the message were right, and that we were able to reach 10,000 users, which was quite a lot at that time, and informed us that we could have a much broader reach than our normal reach of just a few hundred, usually with different social media messages. And now with this response, just to give you an idea, is that we have about 9,000 followers just in general now that we have the COVID-19 response, and the messages in general, regular messages usually reach about 1,000. So but that at that time was quite a large number. We also have print media that we use a lot. So not only can print be used for billboards or bus ads, this year we used a lot for, in 2019, we used a lot for bus ads. We did 2 bus ads on HIV, one for HIV testing and talk testing. The other was for PrEP, the pill that can help prevent the spread of HIV. So we used 2 for that. And then also we did a lead-free ad, which was about how you clean up matters. So we were trying to target that, you know, yes, the test for lead and everything, but other things you do, like how you clean your house, can help prevent the lead dust in the homes from becoming a problem. And we also use prints for posters and handouts. So one of the campaigns we started with just prints and handouts was the Legal Not Safe series. This included, you know, legal not safe vaping and legal not safe marijuana was what we were getting prepared for with the legalization of marijuana in 2020. So we started working on that. In addition to the print, like I said, the educational trainings were important. So staff would go out and provide trainings on specific healthcare concerns, whether that be STD trainings or whether that be code enforcement and helping neighborhoods understand code and property maintenance, things like that. We had a lot of that happening. In our community enforcement section, we were really working on getting ready for the community health assessment and iPlan 2020. And we focused on becoming trauma-informed community. We had a lot going on with that initiative where we celebrated on May 15th Trauma-Informed Awareness Day, where we really had 30 adopters of an early proclamation for becoming trauma-informed. So we had 30 early signers within the community commit to becoming trauma-informed. And by that point in time, we'd also had over 1,000 people trained on Trauma 101. And the opioid response team is another community collaboration that we work towards reducing opioid overdoses in the community. And the group was working on developing policies and standards of care around opioids for better for both the patient and the provider perspective. So really working a lot on trying to get naloxone distribution out and people trained in naloxone use, and that continues as well. So both those initiatives are still continuing. We had a lot of public information that happened around trauma-informed community that year as well. So for our policy and plan, we continued. Cynthia is going to give an update on the strategic report, but you know we always have our strategic plan that we continued with our 3 health priorities of maternal and child health, mental and behavioral health, and violence. We were also began to work on the iPlan 2025 and that MAP process that's used to conduct the community assessment and evaluate for the health priorities. And it's being completed in partnership now with the Community Health Collaboratives. Peter continues to work on that with that group. And in this plan and policy section is where we explain our community response. So we actually did an exercise in August of 2019. We participated in an exercise on, it was called Crimson Contagion. It was on an avian flu outbreak. Again, this is just an exercise that happened in China, that's originated in China and first arrived in the United States through in a case in Chicago. So that was just an exercise. That was in August of 2019. And it really focused on how we were sharing information, what platforms were being used, you know, how health protection would share data, things like that between the different health partners involved. In March of 2019, though, we also responded to an actual emergency, and that was a flooding that occurred in Winnebago County. So we had a lot of flooding, and that ended up in the standing up of the Emergency Operations Center for the county. And our staff had a role not only in supporting the Emergency Operations Center and the joint information in that center, but also in doing inspections throughout the county for assessments of flooded areas and helping discuss potential health hazards and concerns, and make referrals to the community as needed. So that was a big response that we took part in as well. And this might be a reminder to everyone, but public health laws are are always something that is, continuing to evolve. And in 2019, we had a lot of focus and attention on amending and modernizing the Winnebago County Solid Waste Ordinance, which covers the landfill and the waste haulers. So that ended up being recommended by the Board of Health to the Winnebago County Board, and it was adopted into ordinance. There was also a modernization of the county's hotel and motel code that occurred, and those recommendations were also accepted into ordinance. In addition to that, there's laws that can change, also have an effect on us in the local level. So there was a new tobacco purchase law that went into effect to increase the legal purchase age from 18 to 21 years. So as our WCHD partnership with police departments on, it coordinates and conducts underage tobacco compliance checks and provides education on that new tobacco law as well, and to help public health as well. So another domain that we do is we link to and provide care. So a lot of our programs link care. And so this section, we kind of focused on how did they improve care in 2019? How did they improve linkages to care? And so our WIC program had done a lot to provide referrals both to the tobacco control prevention specialists for helping people get connected to quit services from the state, to actually their recipients engaging and following from at the hospital to actually to having birth at the hospital, to be connected to the WIC services with the program within the health department. And especially they were focusing on trying to increase those breastfeeding exclusivity rates. And so they were doing some incentives and things to help with that. So it's part of quality improvement. And our health protection center was working, they went out to Summit of Hope to try to help connect services to those that have been, were parolees, and trying to connect them to services at the point of release and reintegration. Our workforce maintained at about 90% average staff. We continue to do the online trainings, and we also started in 2019 though an orientation on site that all staff went through to get kind of a better understanding of strategic and SIMP and safety and operations that were happening at the health department, just better overall understanding. We also continued with our quarterly all staff meetings, which helped provide trainings for like regular blood-borne pathogens, HIPAA, other trainings that we might need. And this training, we focused one on trauma-informed community and just identifying, connecting with trauma in a different way through a story that was told. And also we train others about specific programs that the staff participates in. And we also help to educate the community on what public health is. So for example, Dr. Martell gave a presentation at the 2019 annual State Line Nurses Expo to explain public health. And I believe he said that we had some MRC volunteers now that are helping us respond that learned what public health was then, and that kind of helped provide that connection. So kind of interesting importance of sharing what public health's role is. We continued our quality improvement plans in 2019. And so one of them that we focused on was one that was actually put together by the Center for Personal Health Services and for the Center for Environmental Health Improvement, in which the blood level indicator of concern changed, which actually created an increase in caseload. And so then there was like a staffing need addressed, and processes need to be addressed to help align the flow to be able to effectively and efficiently address all the additional cases. So they were able to do that with some quality improvement. So our evidence-based practices really highlights that we have a lot of different evidence-based practices that we utilize, and including the All-Stars program, My Generation RX, and we're starting on the teen pregnancy prevention program. And our Better Birth Outcomes program saw a staffing increase that ended up resulting in an ability to serve more families, which is great. For management, we entered in 2019 for our open house. We actually introduced the new logo, and it seems like a while ago. It was the suburban, or it provides that view of suburban, urban, and rural because we serve suburban, urban, and rural community. The continuity of the squares represent our WCHD's ability for collaboration and leadership, and the borderless logo represents inclusivity and the ability of others, WCHD, to work with our partners across all borders of our community. We also welcomed Peter as Director of Data and Quality, and James Peeler as Director of Finance. And for governance, like I said, the Board of Health worked a lot with us on different laws and modernization of some of those ordinances. There was also a resolution passed urging Winnebago County landfill to come into compliance with the Illinois Environmental Protection Agency. We had some visits from some representatives, including we had Dr. Ezike, who was the new director of IDPH at that time, met with the Northern Illinois Public Health Consortium officers here and toured the health department. And then Governor Pritzker also came and signed an executive order to take action to end the HIV epidemic here at the health department in February of 2019. And regular meetings continued between Dr. Martell and City of Rockford and Winnebago County officials to continue to improve the health of the community through different actions within the health department. So that's the domain. Those are the 12 domains of public health and what happened in 2019. And then we get into the data section. The data section is split into really the four centers. So we have the Center for Health Protection, Center for Health Promotion, Center for Environmental Health and Improvement, and Center for Personal Health Services. And I won't go into detail on these as we save time, but I just wanted to note, if you look at the Center for Health Protection and you look at in 2019, the disease investigation and follow-up were 5,305. That's total disease investigations and follow-up. And just in COVID-19 alone now, we've had over 26,000 cases. So it's 5 times that amount. So it just puts it in perspective a little bit, I think. So you can go and look at these, and if you see it go up and down in the end of the data section, you have the chart that shows what it was in 2018 compared to 2019. So you can take a look at that. And if you need a smile, this was the staff dressed up as Star Wars for one of our all staff. And this page just kind of shows how we're funded and kind of gives an overview of the data points that are interesting for our. So are there any questions over the annual report before we go forward? Okay. Then I will turn it over to Cynthia for the strategic.
Katie, would you mind driving for me too?
I sure can. Just give me
Thank you. It's been so long since we talked about strategic. I feel like we need a brief overview. Just as a reminder, every employee at WCHD participates in a strategic plan, and it's broken into 3 goals. One is to focus on core public health. One is to develop and enhance systems to support core public health. And then we work to advance a culture of quality. You can see all those there on that front page. And I'm just so proud of how our groups worked together to get to our objectives in 2019. I miss meeting with them in 2021. Todd Marshall led our policymakers, and they were working on a healthy homes resolution, a mental health policy for WCHD, and a trauma-informed policy that we would implement here and share it with our partners to replicate. Peter led the assessors in their work toward developing annual reports with a 3-year trend analysis. The assessors group was led by Todd Kistner, and that group had the dubious task of helping to produce a report of the strategic plan that included a review of the health priority work groups, and they created a list of all the grant deliverables that were related to those policies. Cheryl worked with the organizers. They produced a digital version of the collective impact training for us. They also created a slide deck to help staff in developing presentations. They created a Healthcare 101 toolkit, and they created a skit on the MAP plan for staff, the mobilizing for action through planning and partnerships. Jim led our collaborators in their efforts to create a list of community partners and perform outreach for the health priorities. And they also engaged our partners in joining on with the Trauma 101 proclamations. Katie worked with the reporters. They developed a bookmark about our health priorities. They developed a presentation about the I-Plan. They produced a health priority video that we play in our waiting rooms. And they created a pregnancy page for our website. Teresa James used to lead the workforce development. Now it's still Lisa Sprecher as the co-lead there. In addition to providing core competency assessments for our staff, they developed a program for new employee orientation, and they also promoted some online trainings for our staff. Mindy worked on the reaccreditation group to collect all the data we needed for FAB reaccreditation. And I know Katie talked a little bit about our health priorities, so I'll just really touch on them lightly. Our maternal and child health group worked with WIC, and they used the adverse childhood experiences tool to create referrals when needed. A subgroup of that was the adolescents pregnancy work group. They received over $200,000 to support teen pregnancy prevention through an evidence-based program with the schools. They also worked with UIC to develop a survey to gauge adolescents' awareness of WCHD services. The Rockford Regional Health Council led our behavioral health leadership team, and they were able to advocate for a community mental health board. They were able to pass a mental health tax referendum, and WCHD continues to provide drug overdose prevention programming. The violence reduction work group focused on making Winnebago County a trauma-informed community. As of this report, there were over 1,000 people trained in Trauma 101. More than 50 businesses signed the proclamation. We did monthly interviews on Good Morning State Line. Harlem School District implemented a handle with care program where children who were having problems could go into a comfort corner and sort of self-regulate rather than be disciplined and sent to the principal. And the trauma-informed community film series continued. So we were really busy as well, and it seems like kind of a flashback to the good old days. Directors, if there's anything I missed, please let me know if we missed some highlights from your groups. I was trying to be pretty quick.
I think that's good.
Thank you.
No, thank you. That was very informative. It's kind of shocking. We went from 5,000 cases for tracing to 20,000+ due to COVID and still going. Hopefully not as much. Nothing for President's report, committee report, executive committee, nothing. Finance committee. I think I saw John's lovely face.
Yes, I apologize, we're a little late. We'll go and do finance. Our first order of business is the approval of the minutes from the February 10th Finance Committee meeting. Do I have a motion to approve?
So move.
Thank you. Do I have a second?
Second.
Thank you. A motion and a second to approve the minutes from the February 10th Finance Committee meeting. Any questions? If none, all in favor, signify by saying aye.
Aye.
Opposed? Minutes so passed. We'll move into the financial statement for January of 2021. Expenditures occurred in the health fund in the amount of $1,429,375.25. I need a motion to approve.
So move.
Second.
Thank you. Do we have any questions concerning this? No questions. All in favor?
Aye.
Aye.
Aye. Opposed? So passed. We will move into the statement of fund balance for the first 4 months of fiscal 2021, October through January. We're doing a little bit of a decrease in total fund balance for the 4 months of about $900,000. It's for information only. If anyone has any questions. If none, we will move into financial review, which is on page 51. Again, this is revenue and expenses for the first 4 months of Winnebago County's fiscal year or the first 7 months of the state of Illinois' fiscal year. What was budgeted, what is actual, and the variance pertained. If anyone has any questions, Jim, any information, anything to add to this?
You're muted,
Jim,
Jim.
you're on mute.
There we go. Overall comment would be that we're about 880,000 deficit at this point, but we are working on a COVID-19 mass vaccination grant, which should, we're hoping will cover a major expense that we had booked this month for the Qualtrics system, which was almost 550,000. So it doesn't at this point doesn't appear like we're running a lot of red ink as it might indicate, but we'll keep you posted on that. So I know that last year we're winding the books up now, and we had a surplus of almost 1.2 million because we had a lot of those grants that were timed in fiscal year 2020. So 2021 is probably not going to look as good, but I don't think it looks as bad as where we are right now. So.
Okay, thank you. We will move into the balance sheet that can be found on page 52. Again, information only, assets, liabilities, fund balance. Does anyone have any questions concerning this? If none, we will move into the bank reconciliations, of which we have 4. It's first is the bank reconciliation for the general account found on page 53 through 55. Gives us deposits and credits, and excuse me. And we have the lead account on page 57 through 56. Also deposits and credits. We'll move to abandoned properties account, which can be found on page 59. On summaries, no credits, no debits to that account. And final, the state of Illinois, the ePay account, which can be found on page 62. There's a 62 to 63. Again, the assets, liabilities, and fund balance, deposits, and expenditures within that. Does anyone have any questions concerning the bank reconciliations for December 2020? None. We'll move to page 56, revenue and expenditure reports, ending in the end of January 31st, 2001. total revenues and expenses through that period. So nothing unusual with that. Jim, anything to comment on that at all?
No, just the top of the second page, you'll notice where they have data processing consulting, the Qualtrics system. You can see where we expensed that in January. So it's kind of the outlier that makes it look kind of a bump in the road here for the month of January. So hopefully once we can execute the grant, we can absorb that particular.
Thank you. We'll move into our public health emergency reserve minimum graph, page 69. We are a little bit down from previous months. Jim, were some of these expenses for the program?
Yeah, and obviously the hit with paying for the Qualtrics, but our cash is slightly above where it was fiscal year 2020. But and we have some receivables out there still to collect. So there's a schedule on the next page. But
yep, actually,
and yeah, that whole thing that has the billings for the last 4 months. And all those in red are estimates because we actually, we submitted 8 of them today that were due the middle of February, and then some of them are on quarterly and in a semi-annual schedule. So we, estimate those, but that's pretty much where we were up to date right there as into January as to what's owed to us by our grantors.
Thank you.
Okay.
And that is, for information, that is found on page 70, in the accounts receivable. We will move into major expenditure requests. Committee meeting, we had 2 expenditure requests, the IDPH electronic filing fee for death certificates and the maintenance for IT servers. Both of those were recommended by committee to be approved. That said, I bring those to the board. Do I have a motion to approve those two expenditures?
So move.
Second.
Thank you. Do we have any questions concerning those expenses? If none, all in favor of approving, signify by saying aye.
Aye.
Opposed? So passed. We have a third expenditure tonight to Winnebago County Facilities. It is replace a condensate tank. That can be, information on that can be found on page 80. The cost of approximately $3,790. This is for the boiler at the Division Street building. And what I see that it's totally rotted out. We have a little information on this.
Yeah, facilities had sent me that bill, and so I, normally if has to do with the building fund, that's okay, but the health department's responsible for Division Street, so I put it through here for board approval.
Okay. Do we need to get an estimate from several places or no?
Well, they went through with the facilities PO and have already done the work. By the time I got this from the facilities people at the county.
Okay.
If I can, Hillary, if I can just say something, I just want to let everybody know we did. You guys approved a phase 1 EPA assessment of that property.
Mm-hmm.
That was a while back. We did get a report back, and it's sitting on my desk. It's about 2 inches thick, and I need to go through that and provide a summary report on that. But obviously, this all ties in of the future of the property. So,
yeah, it's quite. I don't know what's happening. It's quite extensive a report. I mean, I've started breaking it apart. I want to say it's probably more like 5 inches.
Yeah, probably.
And so again, I'm not sure why they did not call us. Normally, they would let us know if there's an issue on the building, like that they, have to maintain. Obviously, they want to keep obviously from flooding or pipes breaking or that kind of thing that's going on there. It's minimally maintained. I mean, the bare minimum is on that building right now to keep it so that it does not become a condemned property. But again, we have not really been able to comb through those documents yet to look at that study so that we can ask the board what they want to go proceed with next on that building.
Question.
Yeah, I have a question.
Found anyone who wants to buy that building yet?
Remember, we've had several people expressed interest in the area and the building, from the Housing Authority and then from the Fordham Forward group. But there's been no solid, since the start of the pandemic, we have not heard back, or no one has aggressively come after us about the building. They knew that at the time, remember RHA, we were very much aware they were looking at that in collaboration with their Brewington Oaks property. To make that into scattered site. But we told them we were going through the first step, but that's almost a year now, I think, since we started this process. So we will continue to move forward on it.
Would it be cheaper for us to actually tear down that building and sell the land instead of putting this kind of money back into that building? And then it gets tore down?
Well, I think that's part of is to get the evaluation on it, Angie. I mean, that was what you directed us to do. So that's what we're doing right now.
Good. Because I can't see us putting that kind of money in a building that's going to get tore down.
Yeah. In fact, if they had called me, I probably would have said, is it? But facilities made the determination, got the work done, and then sent us the bill, essentially.
If the boiler wasn't working, then everything would be freezing and snapping pipes and all of that. So it was almost essential. We had to do something bare minimum.
But they know they're not doing anything more than that really on that building. But I think we have to, get through that first environmental and then an assessment and appraisal of the property value so that you can make a determination whether the building, whether or not the land or the building, I'm going to say probably not the building, but,
And why can't we drain the pipes?
Yeah, I think there was more to it because there's heating with the radiators and all that kind of stuff. There had to be water in the system. That's what I was told. So.
Thank you.
Yep.
That system has radiators because you have to have water if it's radiator. I didn't pay attention.
You had to have water running through the system to keep some type of heat so the pipes wouldn't break. Without that boiler, it would insufficient. So that's the reason why they had to do it. So
why don't they put antifreeze in it like we do boarded up houses? We put antifreeze into the foreclosed homes. You put antifreeze in the system.
Yeah, that would have been a possibility. That is true. So.
I know it's going to take a lot of gallons of antifreeze, but it's still a lot cheaper.
Yeah, but I think the work order said ride it out.
Yeah.
So, we'd have poured it in there and it'd have wasted all.
Just
we had a chemical spill then into the.
Yeah, that's true. Very true.
But they know that we are not intending. As I said, I think, Angie, they understand that we are not wanting to upgrade that building. It's not occupied. There is nothing in the building except, again, determining what the next step is. And so we had hoped that the environmental assessment is a little, I'm going to say inconclusive from our initial read on some of it.
Who did the environmental? Can you recall it just offhand?
Oh shoot, it was Gallagher Bassett.
All right.
Which was referred to us through HR here at the county. Counties use them for multiple.
Right. That's what they recommended building, the group that they use for appraising all of their buildings.
Todd, do you have a rough estimate on when you might be able to give us kind of a summary? I know your hands are full with a lot of other things, but.
Oh, I just stepped into something. No, but seriously, I have kind of sectioned out myself, but it's going to take a little time. Obviously, priorities, the pandemic, but yes.
Probably, I would say we're going to try and set a deadline. We'll set a date for like spring, right? The next couple of months.
Something like that, that'd be great.
Yeah, I think doable. Yeah.
Because going through something dramatic comes up, don't wait for the full report. Would like to hear it before, but yeah, that'd be great. Thank you.
Perfect.
Okay. We had a motion and a second to approve the replacing the condensate tank at the Division Street Health Department building.
Second.
All in favor, signify by saying aye.
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 Opposed? Expenses passed. We are finished with expenses. We will move to proposed contracts and agreements, of which there were none. There is a permit fee reduction proposal. And that is
Kind of following in the policy committee.
Is that policy?
Mm-hmm.
Okay, I'm sorry, that was under,
I think it was put under finance for some.
it was put under finance,
Yeah.
but I see also where it is under policy. So I will pass that on to policy then. And then if we need to swing it back for approval of a cost, we can then re-enter into finance.
Excellent. Great segue to policy committee.
Threw you a curveball there a little bit, but anyway. All right.
Well, I find it interesting. It says permit fee reduction since we're increasing the fees.
Two different programs, sorry.
Yeah, I'm not sure why that's like that. But anyway, speaking of antifreeze, I've been using a lot of antifreeze in the last couple of months.
Yeah.
And not in my car.
Put an olive.
You know how it goes. Where's the glass? It's right there. I need approval of the minutes of our February 10th, 2021 policy committee meeting.
Move
So
approval.
moved.
Second.
Awesome. All in favor?
Aye.
Opposed? And why would you be opposed? 12-220 Harbor Oaks, McChesney Park variance request update, nothing. So we stymied them with our letter of last time. Maybe we'll never hear from them. Maybe they'll make it into a park. I'm not sure, but they may have problems meeting our questions, answering our questions. The last item is the fees and an agreement. So the Winnebago County Soil and Soil and Water Conservation District raised their fee. We appropriately have to raise our fee to try and cover our costs. And so you will have in your packet on some page 86, the proposed fees. We have no control over their fees, but we have to pass them on. Our fees are being increased, and it's going to just be initial borings and supplemental borings. And it'll be $150 for proposed initial borings, and then the proposed for supplemental will be $175. We need an approval of this by the health board, recommending to the county board to approve these fees. Do I have such a motion?
So moved.
Exactly what you said.
Thank you.
Second.
All right. Any questions, discussion? Again, we're just covering our costs. All those in favor?
Aye.
Aye.
Opposed? Okay, to go along with that, we want to enter into an agreement with the aforementioned Winnebago County Soil and Water Conservation District. And we want to follow the pattern of the agreement that you have in your packet with the addition of a term. In other words, not having it open-ended, but having a 2-year term. And that will be changed. It'll be run past whoever we get from the state's attorney's office to approve and look at our documents. But we want to get some approval from you first that we could do that. And it's just to make sure we're both operating properly and getting the borings, et cetera. It kind of sets out what we're doing right now anyway. And I love it when Todd shakes his head because I know I'm doing it right and saying the right things.
All right.
So I need a motion to enter into an agreement with SWAC, or whatever you call that, SWCD, for the incorporation of the new fees in our working relationship.
I move that we approve that.
Second.
Second.
Any other discussion?
I think it might be helpful to talk a little bit about why we wanted, one of the things I think we talked about in setting a date for reexamination of it was to keep our fees current.
Right.
Right. Yeah. I think you just explained the whole thing.
Yeah.
That's why we need a term. So we don't just get lost again in the wilderness and start losing money on what we're doing. So, and I guess we don't have anybody from the state's attorney's office yet I really hate to see Charlotte go. I mean,
I know. Well, it looks like we have been assigned someone. And again, I think she's just in orientation. Her name is LaFaccaria Vaughn, and she goes by Lafa Vaughn. And she worked with the city of Rockford. So she was one of their municipal and so she is getting, currently, I think she's on day 2 or 3 of her orientation, but she will be assigned to the health department and will participate in future board meetings.
Is Charlotte still at the state's attorney's office, or does she go?
No, Charlotte is now with the city of Seattle.
Really?
What?
Wow.
That's a change.
Yeah.
Wow.
That was in the paper.
I must have missed it.
Yeah, I missed it.
I read all the obituaries, but I must have missed that one.
We're talking about
Nothing on the
Seattle,
obituary
Washington.
page.
I find reading the newspaper on my tablet, I miss a lot of things. It's amazing how much you miss that you don't see.
Well, and again, we're looking forward to working with our new state's attorney and bring her up to speed. I know Angie, I know that they're just kind of reorganizing so that every board, like River Bluff, has an attorney, and so
I
I
did talk to our new state's attorney in regards to our committees, and I don't think he was aware of the fact that he needed to assign attorneys to our different committees to keep us out of trouble and to give us advice. He was kind of startled when I told him that we need one for the health department, River Bluff, and I said zoning, the whole thing.
Mental health.
And yeah, mental health, we need an attorney for everything. And he listened to me, and so hopefully I didn't want to talk to him on our open caucus meeting in regards to it. So I talked to him privately about we need those attorneys to be part of our committees and our different entities of our, otherwise it's ridiculous. We're hanging out there.
Well, and I think that, there's still obviously an orientation. I know we've already had some conversation with Ms. Vaughn. We're working on some things related to suspension of food permits. And so I know he's been brought up to speed and is working on that. And I think kind of looping back, so again, the permit is not, the fee reduction proposal was a placeholder. We understand, just to give everyone some information, that the Winnebago County is wanting to do some, Angie, this is out of the Economic Development Committee.
Yes.
And they want to give food permit holders, the high-risk food permit holders, a rebate on their permit fees. And so we would have to, but they would, basically abate our cost. But it's unclear the process that they want to use, whether they will approve that first and then have us go through it. So they've not given us a formal proposal yet about how that's going to work.
Why do they want to give them an abatement?
Well, because during the pandemic, they've, lost revenue.
Mhm.
Isn't that similar to the abatement on liquor license fees
The
that
city-
people got?
Yeah, the city did that. Yeah.
Correct. But they want us to what they want to do then is abate the monies back to us, recognizing that there was still a need for them to carry permits for their carry out and curbside. So it's unclear how what normally we would ask for our permit fees to be abated. And instead they're kind of reversing the flow. So we have that, but we don't have the formal resolution or what they're going through yet. So that's why it was a placeholder. It wasn't tied to Todd's permit, his soil boring increase.
Well,
Did they say, excuse me, did they say where we would get, since it's an economic development, were they planning on taking that out of the host fees?
Yes, Angie, that's what we understood.
Okay.
there was a very interesting discussion on the motion to approve this agreement with the Winnebago
Sorry, I
County
missed that.
Soil and Water Conservation District. I'm not sure how relevant most of it was, but it's very interesting. All those in favor of the motion? Aye.
Aye.
Opposed? And someone mentioned mental health board and lawyers. Is that an oxymoron? And I can say that. That's all,
right.
Mr. President.
No personnel committee, no quality committee, but under new business, the 2021 membership fee for the Rockford Regional Health Council.
And we put this on the agenda because last year that there was a lot of discussion about whether or not to renew the membership. There is no increase in fee. So that I can tell you that they did hold membership fees stable this year. So I thought before we took it through Finance Committee and had a discussion putting it up at this point about our membership dues.
What exactly what does this fee grant us? What is our benefit from this membership?
Well, I think at some point, I mean, this is a historical membership that you've had for years, and you probably know more about the history of the organization and what its role was or is going to be. So I think that one of the things that that we have to look at is whether or not they're able to bring together people up from various sectors at the health table. And some of this has morphed through the pandemic. We now have a policy group that meets routinely that, I mean, with the health system CMOs and, or I should say CEOs, and then there are designate CMOs at various times about strategies and policy. I think that, we were participant. We engaged them to be partners with us because all of the entities that were doing health assessment, and we still have our I plan and our 5-year plan. Believe it or not, we're doing this at the same time. So we formed the Community Health Collaborative to meet both the needs and justification, if you remember, for both the hospitals and their IRS mandate for not-for-profit status, as well as the health department on their mandatory 5-year community health improvement plan and assessment. And then Rockford Regional Health Council has also done an assessment. So trying to align some of those together. I think that, it's an evolving discussion and situation. I think there was some of the discussion you had last year about value. They're not a lobbying entity. And again, probably at this point, we were able to move when the mental health, if you remember the sunset on the mental health, we asked them to take that strategy on. again, as part of moving that forward. But again, that, could have been another entity as well. But so that's, kind of in the nutshell in the last couple of years that, we've worked with them. And again, I think that I know that it was, I was reading through some while back about the history. It was obviously a purchasing co-op at some point for health insurance for our employer community. I'm not sure that that's still kind of their role or function, but they indicate that on there it says data gathering and analysis, education and advocacy. I think it's very similar to what we call our 3 core functions of assessment, policy and assurance. We have the role of assurance. That's probably a little bit different. We've seen a lot of our assurance function this year, more than we like to see it, but that's part of our roles, So again, that's kind of that. And it was just to kind of put the thought, and this is where it's at. Obviously, I think it might require some more discussion amongst, as a board and some considerations moving forward. But I wanted to put it on the agenda to show it again as an item there before it is taken up, and whether we want to take it up in finance as a straight expense, or if we want to have a different discussion at the executive level, that's up to you.
Okay.
My remembrance is that there was a collegial aspect, to this membership, for the health department, along with the other major health entities, collaboratively working on different things. So I think there was that strong collegial element that also informed some of our thinking in the past too.
I think the question is a good one to keep considering. Have we moved beyond the usefulness or not? But I'm not sure in the middle of where we are right now, I would change.
Might not change, but did we not before only give them half of what they asked us for?
I don't believe so.
I think we did.
No,
I don't think so.
We didn't give them any more. They wanted additional funds for the community health study. And we said, no, we already contributed. We already were responsible for that. So we did not pay the additional monies. It wasn't quite half, Angie, but you're right. We did not pay them their full dollar amount.
Yeah, that's what I thought. Because at this point, do they need, how many entities are giving them $7,000 each? Are there 10 of them, so they need 70,000, or how many others are out there contributing to this?
Is it based on the size of the organization? So we're actually in the lower end?
Right. If you remember, the hospitals probably pay a larger share of dues and membership fees. So I think that we're probably on the lower end of it at that point. But I also think that probably the other, kind of, I think discussion, as you move forward is that, again, the value add of the community health assessment, those kinds of things. And I mean, again, we have to kind of take a look and see, this is a year, in terms of change and things like that are going on. But we were very firm that we were not going to pay any additional fees related to that, because our contribution was the actual assessments that we were doing.
I'd sure like to see their budget.
Oh, I'm sure we can get a copy of their budget.
Well, whatever you decide, we'll do.
Well, I think it has to be taken back to finance as an expense, correct?
Correct. We can take it back to finance for the committee, but again, I think that's where we can go through the nitty-gritty on the dollar amount.
Okay.
But you mainly wanted to get us in front of us tonight, correct?
It was to get it. It had come up and we said, last time there was a lot of discussion both at the finance and the board. So I said, let's put it on the agenda for people to see the dollar amount, what it is, and then we can go back through the committee process.
Makes sense.
Excellent.
I would move that this issue of membership with the Rockford Regional Health Council be referred to the Finance Committee to be put on their agenda at the next committee meeting.
Do you need a second to that?
Yes.
Second.
All in favor?
Aye.
Okay.
Aye. Any opposed? Excellent. I don't believe it's for further correspondence or additions. Do we need an executive session?
Nope.
I don't even know how we would do an executive session on YouTube.
No, we know, yeah. The county board, they've gone to closed sessions, yes.
Really?
Yep.
Oh,
We go-
that'd be interesting.
In fact, in regards to what I just saw on my computer, regarding Dr. Martell asking us for directions with a situation right now, I think we should go into closed session on this.
Okay.
I know it doesn't involve employment, and I know it doesn't involve finance, but this is something that we need to discuss between how we would give Dr. Martell direction.
And it could involve litigation, as you probably figured out.
Okay.
Can we do an executive session with this? Could
Whatever will work.
I would imagine you pull it up live and you can do it.
Yeah, you do the same thing. You would vote to go into a
Right.
matter regarding potential litigation.
Okay.
And
I
then-
do not.
That was my question, litigation.
Yes, I do not have the exact number of the Illinois statute.
Well, forget
Something like 5 ILCS something or other.
I
Well,
bet
leave it for-
Christina has it.
Yeah, she'll fill it in.
Yes, Christina can fill it in.
All right. So
Need a
we
roll
need
call vote though.
right. So we do need a vote to go into executive session.
Well, you need
Yeah.
a motion first.
Oh, we need a motion. I'm sorry, to go into executive session.
I move we go into executive session to discuss pending litigation. Is that correct?
Potential.
Potential litigation.
Second.
All right. All in favor?
No,
Aye.
roll call.
We got
vote.
called roll.
Roll. I move to call roll.
Call roll. Aye.
Here.
Here.
Yes.
Yeah, there's no here. It's
Oh,
yes.
yes.
no.
It's yes or no.
Yeah, there's
Yes.
no here.
Oh, that was here.
Yes.
Oral,
Yes.
Yes.
I believe that's everyone. Yes.
Yes.
So we
All
have
right.
to come up live.
Disconnect.